and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
You know, this is a case where we have ugly mugs on a mug.
Can you zoom in on that, Liz?
Should I be a little closer? Or?
There you go. Wow, this is a nice one. It says, today is a good day to have a good day. Yeah, very little.
All right, let's go to our topic at hand here. Sciatica that doesn't improve. If you have sciatica that's just not getting better, you must see this for success. We're going to give you really kind of the routine that you go through with patients when they don't get better, the steps that you go. Kind
little
of
secrets. This is my, I wouldn't say
your
it's my
secret sauce.
Right, there you go. It'll give you a few options.
Pearls of wisdom.
There
By the way,
go.
if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Brad needs to follow our own advice with his painful hip. Join us on our social media channels because we're always giving away something every week. Right now, we're giving away, once again, a mattress by SleepOvation. And it's got 700 tiny mattresses. This is just a cutout of a portion of one of the mattresses that we can use as a sample.
Right.
It's got airflow channels.
It does.
So, but we're giving one of these babies away.
You better believe it, Bob.
All right. What, do you want to go your way?
Yeah, let's go my way. Yeah, Bob, I had a little cross-country ski accident this weekend, so my hips on the fritz. So you're going to be the...
All right, I'm going to be the patient.
Yeah, why don't you stay standing, Bob?
Okay.
So, and face that direction. There we go. So sciatica, we're talking about back pain, but it needs to radiate down one of the legs and oftentimes below the knee, very commonly to the foot, and sometimes all the way up into the toes. So if we imagine Bob having, and it's not just pain always, a lot of times it is numbness, tingling, cold sensation. That's all.
It's really bad. It could be weakness.
Yes, right.
Foot drop.
And if you're getting foot drop or weakness, then it's time to go in. Don't even work with this on your own. But if you're living with it and you have some of these symptoms, it's not too serious and you want to get rid of it, the first thing that I'll do oftentimes with the patient, I'll have them lay down on their stomach, and right there I'll ask them how it feels, and sometimes just laying like this typically feels better overall. And that's a good sign. If you lay on your stomach, it feels better.
Well, tell them what you're looking for, Brad. What you want the pain to do.
Right. We want it to something we call, I'm going to give you this to put your forehead on,
sure.
Bob, because you don't look comfortable. This works better than a pillow, so you can keep your head on. Is that too high, Bob?
No, that's fine.
That's okay? Otherwise, I can give you this one. You can.
No, that's fine, Brad.
All right.
I'm good.
So we're looking for the pain or the numbness, the symptoms where there that are going down the leg. We want them to centralize or go up this direction towards the back. So if you lay down like this and all of a sudden your foot starts to feel a little bit better, that's a really good sign. So I'm just going to have the person lay there for a while. If nothing happens, but it feels okay, well, then I'm going to ask them to do some press-ups.
Before we do that, Brad, we might mention that some people can't lay in this fashion, and sometimes they have to lay with a couple pillows underneath them to start off with.
Yep.
And in that case, so they might start off with even 2 pillows, and then work their way down to 1, and then work their way down to 0.
Right.
So, and then at that point, you could try like prone on elbow, or
Yep.
do you want or press up?
Well, and that'll depend. You go prone on elbows, and if that feels better,
It's kind of a prop.
yeah, and you can stay like that. Sometimes, people respond well to this, but sometimes then they actually need the motion. So if that's not working,
hands underneath the shoulder.
Yep.
And I'm going to start just pressing up. The key here is that you do not lift the pelvis off the table.
right.
The pelvis needs to stay on the table, so that means the motion needs to occur in the back. You need to be arching the back a bit. If you're going up like a board like this, that means you're really tight and you need to work in this smaller oscillations right here.
Right.
And start getting some movement there.
Now, sometimes I'll put my hand right here just to cue them. I'll make sure it's glued down to the table, I'll say. And sometimes I'll say, make sure you go all the way down so they're flat, just so you get some more motion if they're not responding well. And if they're going up like this, and each time it feels like it's getting easier and they're going higher, that's a really good sign. And along with that, if the patient reports, boy, my foot and my calf are feeling better, they feel normal like the other leg, boy, then it is centralizing. Then you know you're right on the money
Yeah,
with
that's
this
a great
exercise.
sign.
Right.
And you want to go further and further. You want to go as far as you go. I mean, eventually you want to get up to here.
Sure.
You want to get all the way up and even bring your head up
There
if
you
you can
go.
too.
Now the next, if that's not working and they're doing the press ups, I do 4 or 5 and things are not getting well or getting worse in the leg, then I'll definitely stop right there. And then I'll go into the banana, what we call the banana. And if you're looking from the top down, I'm going to shift Bob's hips only, keep his shoulders and his knees where they are. And if the pain is going down the left leg, I'm going to shift his hips to the right. So now he's got this banana shape if you're looking from the top down. And at that point, I'll leave him or lay there for just a minute or so, maybe even less. And sometimes just doing that can improve symptoms.
Yep, I've seen that.
Yep. And then I'll have to do the press-ups at that point. If nothing is getting worse, but it's not getting better, now I'll say, well, let's try some press-ups, but let your body be in that banana shape.
And generally, it's a little harder to do press-ups when you're in the banana
Yep,
shape.
it is.
So I often people don't go up as far, but
Right.
that's all right. Again, what you're looking for is your symptoms to be improving the further they are away from the back. So, you know, in the calf and the leg, are they getting better?
Yep, moving up this way, starting to feel normal down here. On the converse, if you do these and for some reason they make it worse and go down the leg, that's the red flag. You're going to stop immediately.
That's always the case. No matter which one of these you are doing, if it makes it worse going down the leg, you need to stop immediately and try something else.
Right. So then I'm going to go to the next one. If that one's not working, why this is named Roadkill, I really am not sure, but I got this name from one of the McKenzie instructors.
Well, I think it looks like roadkill.
I guess
the
so.
Animal is...
So I'm going to have the person going this way. And I got to tell you, Bob, I've had some pretty good luck with when the other ones aren't working, I'll ask them to go in this position. And if they immediately say, boy, that feels kind of good.
Yeah, without even doing press-ups.
Right. Then I'm thinking, oh, we're hitting the button right now.
So do you see what I did there? I just took my leg up and you can put your foot almost on your knee.
Yep, right here.
Yeah, and you bring the knee up, and so you look if you looked again from the top down, from the ceiling down.
Yep.
I kind of look like I've been killed on the road.
Whatever, we're going to call it that. This is
Hit
the
on the road.
position.
Yeah.
If it feels better this way and the leg starts to improve, and then I'll lay there until the progress doesn't, say it goes up to the knee, but it stays at the knee. Then I'll say, why don't you do some press-ups? Now, you'll see in a road,
Again, more difficult to do in this position.
You're never going to get as high in this position as you are with the one we first started with.
Okay, what's the next one, Brad?
And if it continues to progress, we'll have them do 10. And from all of these, no matter which one you do, when you start getting centralization, I have them do 10, and I'll have them repeat that at least 5 times a day, sometimes more every hour if it continues to improve.
Some people may complain about that, but really, you know, it took a long time for you to develop this generally, and to get rid of it, you need to do some due diligence, and you need to spend the time. I've had people at work at factories that actually put cardboard on the floor and would do these every hour.
Sure. Yep.
So
now, if this one's not, you're getting, now this is the third or the fourth one we've done, third one, then I'll have the person lay on their back. This one is kind of hard to do by yourself.
Yeah.
I've had patients do it by themselves, but I have to instruct them. And what I do is I go up to this position and keep the knees together, and then I'm going to roll this direction. Can you take that hand and put it across your stomach?
Sure.
There we go. And then I'm gently going to go this way. And then I have to slide the hips this way. Now, there's a way I have the patients do this at home, and I'll show you in a bit. But if we go in this position, and all of a sudden his right leg pain and symptoms are improving, then you know you're gold. If this becomes painful and not tolerated right away, then we're just going to stay away from it. I don't know. I have success with this one. Not a lot, but when it works pretty darn good. Yeah.
Yeah, this one, Mulligan taught this one too.
Oh, really?
Yeah, he would again have them go like this and like this. You
Yep.
almost have to hold on with
Yeah.
your hand on this side,
Yeah.
otherwise you could roll right off.
One little thing I'll have patients do is I'll say, just bridge up a little bit, and now shift your hips that direction away from the pain, and then I'll have them do it.
Sure, then have them do it.
Sometimes
So
that
they're
helps.
they're already in the right position. Then.
Yep. Yep.
So
And then you'll do that, and you'll just lay there. And again, as long as the leg is feeling better and the betterness moving up towards your low back, we'll do that. And this, I won't have them do 10 repetitions because
Right.
it takes a little more effort.
Yeah.
So maybe 3 or 4 repetitions as long as it continues to centralize. Now, if all these are making things worse and not progressing, then I'm going to go to some self-traction.
Gotcha.
So in the clinic, I'll use parallel bars or possibly a walker, but what you can do at home, you need to get some nice solid chairs.
Or you could have one chair and one countertop.
Sure.
I mean, if they were about the same height.
2 solid surfaces about your waist level. So if Bob does this, they should be taller chairs, and this is
Right.
what I can do. And it's nice that you can lock your elbows out because then it doesn't take much arm work. So I'm going to lock my elbows out. I'm going to come up on my toes. These chairs are just about perfect for me. And then I need to relax my trunk. And then I'm going to unweight my toes. Now my toes are just barely touching. And what that does is that put traction through the lumbar spine, and it decompresses or takes the pressure off that nerve being pinched, creating the pain and symptoms down the leg. Now, when you do this, if you should immediately feel relief down the leg. If you don't, or it makes it worse and it becomes very uncomfortable, you just stop. When I have this with patients and they go like this and they put a smile on their face right away, then they're going to do it at home. But if not, and they're doing this and it's uncomfortable or they're having a hard time unloading for whatever reason, then we stay away from that one too. And if none of these work for you, you might want to go see a therapist.
Yeah. And I would say also with this, Brad, if this starts to work, you do it quite often throughout the day, and eventually go back to the press-ups again.
Exactly.
Try to do the press-ups again because you always want to see if you can get back to
Yeah,
that.
that's a real good point.
So, and you could also hang on a pull-up bar.
Yeah,
Yeah.
right here.
So-
Oh, we got our bed in the way.
Yeah.
But a lot of people don't have them. But if you happen
Right.
to have a pull-up bar, this will give you that lumbar traction as well.
By the way, I know the question that's going to come, Brad. It's going to seem like say, "What about an inversion table?"
Sure.
And you did an inversion table
Yep.
for years, and it did help you.
Yep.
And I would say in this case too, it possibly could help.
Right.
I would like you to try one somewhere without having to purchase one because they're quite a bit of money.
And sometimes they don't work. And we
So
do have a
right.
video with complete details on
Yeah.
how to purchase, what to look
How
for.
to purchase and how to use.
Right.
So-
Exactly.
Oh, it is that late already.
It is late,
Okay.
Bob. We got to get going.
Thanks for watching.